midst of the greatest global public health crisis of our time, we gather remotely today to welcome a new class of public health professionals. I'd like to start by congratulating each and every one of them for their many achievements over the past 4 years. Hello, my name is Richard Dees. I'm a bioethicist and a philosopher, and I chair the steering committee for the public health related majors. Later, we'll hear from the other members of the steering committee, Nancy Chen, who's an anthropologist, Edwin van Wingarden, who's an epidemiologist, Molly McNulty, who's a public health lawyer, and Mikal Raz, who's a physician and historian, and the Charles and Dale Phelps Professor of Public Health and Policy. You can tell from the list of the fields we represent that public health is a decidedly interdisciplinary field. To master it, students have to see health and health care through many different lenses. They must study the socioeconomic factors that impact health. They must study the features of our psychology that affect well-being. They must study the economic implications of health and the statistical profiles that show us its contours. They must study the history of the institutions that shape healthcare policy both in the U.S. and globally, and they must study the ways that those systems embody, or more often fail to embody, key ethical values. Each student before you has taken up each of those lenses, and as a result, each has had a multifaceted education. But each has specialized in one aspect of the study of health and healthcare as they're clustered in our 5 majors: bioethics, epidemiology, environmental health, health policy, and health behavior and society. All of our majors embody the best spirit of education in the liberal arts and sciences. They emphasize analytical rigor, critical thinking and writing skills, and a broad humanistic understanding of the discipline. We think you'll be amazed by what they know and what they can do. I would like to recognize 2 groups of students in particular. First, each year the program gives the Dr. Holly Atkinson Prize to the students who best embody the goals of public health advocacy. This year the prize goes to Miles Perry and Paul Makshiski. Miles has been an advocate for the LGBTQ communities of color, working with the Corner Health Center off campus to help bring in queer youth of color into the clinic, and as president of the Pride Network on campus, where he hosted the first Queer Ball, which connected the campus community and the greater Rochester community to LGBTQ health centers in a safe environment. Paul, after working with the Street Outreach as a part of the Community Engaged internship course, has been working with the Peace Village to address issues of environmental justice among the homeless community in Rochester. Second, I want to recognize our honor students and to tell you a little about their research projects. Margot Maston has been working with the Medical Center Research Group on Batten disease, which is a debilitating degenerative neurological syndrome in children. She's been analyzing data about access to specialty care and data about how the various forms of the disease progress. Her work has already resulted in a first author publication in a major journal. Monica Morgan has been studying the ways that FDA has responded to the expansion of products using the hemp derivative CBD. Lilo Blank has been thinking about trends in society surrounding gender norms that clash with the trends in law surrounding abortion. And Cameron Tate has been looking at the ethical issues that surround the potential source of the next great public health crisis, the rise of antibiotic-resistant bacteria. All our students deserve the congratulations that come from the hard work that they've done over their time at the University of Rochester. Now we'll hear from 2 members of that senior class, Miles Perry and Rachel Goodman, and then we'll hear from the other members of the steering committee.
Hello, everybody. Congratulations to my fellow seniors that are graduating from the Public Health Department. I really want to take this time to thank all of the Public Health Department for being such a tremendous help in our growth as students and public health professionals. I know that this is not necessarily what we wanted to graduate like, but hey, at least we're coming out with a job. I've heard the news say public health on it more times than I've ever heard in my life. More times than I think I heard the word public health was said in actually Public Health 101. I really want to thank Ted Brown for being my introduction to public health and really allowing me to let my passion grow in public health in my first class with them, Intro to U.S. Health Systems. I also want to thank Nancy Chen for being such an amazing, wonderful person. Honestly, I don't have words to describe how much growth and just love that Nancy Chen has put into all of us as students, especially me, and helping me write my letter of recommendation, supporting all of the endeavors when I ever protested or needed support from a department. I'm happy I get to turn to the public health department. I think one thing that really stuck with me in my public health career is when I was taking Professor McNulty's class, and she said, "There is no public health without the law." And I think that's what really inspired me to pursue my second major in international relations, so that I could study more on the law on a global focus. And what has also inspired me to take on my new concentration at UNC when I go to grad school next semester with global health, which will be the combination of the two. So I really want to thank all of the public health professors for being such amazing people and contributing so much to our growth. Shout out to Jen Sherwood for always helping the department navigate where we're going next. And just thank you so much for having so much love and compassion for your students.
Hi everyone, my name is Rachel Goodman and I am a health, behavior, and society and psychology double major. So, first off, I would just like to say congratulations to my fellow seniors. I know this isn't really what we pictured today looking like, but it's still a really big accomplishment and I hope you have some special way to celebrate. Thank you to our friends and our family for their support, and thank you to our public health mentors, advisors, and professors for all of their wisdom and guidance over the years. We truly could not have gotten through college without you. So I came to the U of R not as a public health major, but my freshman year I took Public Health 101 and like many students fell in love with it and have been studying it ever since. I know we have 5 different concentrations, but I think there are some key takeaways we can all reflect on today. We've learned how to look at health from a holistic perspective and how just so many different systems and factors interact and come together and produce the current health framework and environment we have today. We've learned how to think critically and how to come up with creative and innovative ways to investigate public health and address issues we see in our community. I know that we're leaving with the knowledge and skills to be public health leaders wherever we end up. So it has just been an absolute honor and privilege to study alongside you guys the last 4 years. I am just constantly amazed by everything you've accomplished. We have students who have created health interventions, who have served as peer health advocates, done research, study abroad. The list just really goes on, and I'm so grateful to be a part of this community. I think what I love most about students in our major is that everyone's passionate about public health but has their own way to express it, whether it's working in the lab, in academia, in the classroom, or out in the field. So, wherever public health takes you next, whether you're a healthcare provider, a lawyer, a public service worker, a social worker, what have you, I hope that we can all work together and help make our world a better place because right now the world needs public health leaders like us. So let's roll our sleeves up, wash our hands, and get out there. I'll see you there. Congratulations, guys.
Dear Public Health Class of 2020, family and friends, my name is Edwin Vermeingarten. I'm a professor of public health sciences and faculty advisor for the epidemiology and environmental health majors. I give guest lectures in the introductory Public Health 102 and 103 courses and teach the environmental health course that is a core requirement for the environmental health major. I also teach field epidemiology, a graduate course that is an elective for the epidemiology major. My primary area of research is to study the effects of exposure to toxic metals on neurodevelopment and behavior. I'd like to congratulate everyone in the class of 2020 on your incredible achievement. While I'm sad to not be able to celebrate this moment with you in person, I feel very privileged to have had the opportunity to get to know many of you, to teach you the key role of environmental health and epidemiology in public health and prevention, to conduct research with you through independent studies, and to help guide you as you are planning the next phase of your careers. I know it sounds cliche, but teaching and mentoring students is really the part about my job that I enjoy the most. I enjoyed the discussions we have had in my environmental health class about the interconnectedness of the environment with health and disease processes, but also with politics, policy, and sustainability. For those of you who took field epidemiology, I enjoyed learning about your research interests as we worked on a semester-long class project together. Public health problems are inherently multifaceted and complex. It is rewarding to see that you, as graduates of our multidisciplinary programs, understand the broader context and implications of the public health challenges we face today and are ready to tackle these problems with creative and innovative solutions. Your passion for public health and your creativity give me hope and inspiration for the future. I can only hope that we as faculty have equally inspired you. Please continue to do the good work you've already started here. The world sorely needs you. And as you are applying your talents to make the world a better place, please don't forget to tell us about your successes and don't hesitate to ask for any advice. We are invested in your success, and that doesn't stop at graduation. So please don't be a stranger.
Welcome, graduates, family, and friends. I'm Molly McNulty, a health policy lawyer and assistant professor of public health law and policy. And I'm here to congratulate you on a very, very hard-won diploma. The guru of health law, Lawrence Gostin, says, "The most important societal debates about public health take place in legal forums, legislature, courts, and administrative agencies, and in the law's language of rights, duties, and justice." For those of you who took my courses, I also want to congratulate you on getting through them. Law courses are notoriously rigorous and mysterious, yet in many cases you perform better than law students themselves would have done. I've taught many of you in healthcare and the law, public health law and policy, maternal child health, policy and advocacy, and public health community engaged internships. You have learned that there are tremendous injustices in health status and access to care, and that there are relatively few advocates for the marginalized. My goal has been to educate you on the need and the tools to become warriors for health justice, whether through legal reform efforts involving legislation, regulation, and court cases, and with advocacy skills such as joining coalitions, legal research, letters to the editor, blogging, and summary fact sheets. Wherever you go next, and far into the future, I hope that you will remember how much your knowledge and skills can be used in the fight for health justice. Warriors for health justice, all hands on deck. Good luck, and stay in touch.
Welcome, graduates, friends, family members. My name is Michal Raz, and I'm a professor of health policy and a physician over at Strong Memorial Hospital. I've had the chance to meet many of you this past year in my introductory course on the U.S. healthcare system and in my advanced seminar on health policy and politics. Graduating, especially amidst this pandemic, likely brings on a mix of emotions. I hope you take time in the midst of everything going on and stop and recognize your amazing achievement and take pride in all that you have accomplished. Wow. It's my first year here at the University of Rochester, and you guys, you're my first graduating class. It's been a huge privilege getting to know many of you over the past year, and in particular, hearing and learning about your passion for public health and your commitment to make a change. One of the themes I taught in both my courses this past year is that our country's health policy reflects our ethics and values, and the system we have in place is in no means inevitable. Your engagement in thinking about productive ways to reform and improve our country's approach to public health, it's just been inspiring. Young, idealistic public health experts, which all of you now are, you guys, you can go ahead and make a huge difference at both local and national levels. And I know that you guys will go on and do great things. As devastating as this pandemic has been, it is also an important moment in which you can apply your training and passion, think critically, and work to improve the health of our communities. We are lucky to have you leading the next generation in public health. I wish I could be there to congratulate each one of you in person, hug you, and wish you all the best. I am so proud of each and every one of you, and I'm rooting for your continued success. I'd love to hear from you as you advance in your lives and careers. Please stay in touch. Congratulations.
Parents, family, friends, faculty, colleagues, and the graduating class of 2020. Congratulations to all of you. We made it. I'm Nancy Chin, the academic advisor for the Health, Behavior, and Society major. Graduates, I invite you to hearken back to that fateful day in which you declared your major. What were you thinking? What were you feeling? Perhaps you were slightly nervous, questioning if you'd have a significant role in world events, wondering what you're going to do with a degree in public health. And yet here we are. You are on the cusp of joining the most critical discipline of our lifetimes. The National Academy of Medicine defines public health as what we do collectively to ensure the conditions under which all communities can be healthy. The current pandemic reveals to many people what you already know. There are vast health inequities in our society. You have the knowledge and the experience to make great changes in our approach to keeping all communities healthy and safe. This is your time. Go forth and work collectively to create healthy communities. From the bottom of my heart, I tell you, you will make a difference. Melihora.
Ordinarily, at this point in the ceremony, we would call each of the graduates to the stage to present their diploma. Instead, we invite you to enjoy the pictures of our graduates on the website. But we do heartily want to congratulate each and every one of them. And we also want to congratulate the many parents and family members who have helped to make this day possible, especially in the past few months when you and they have been in rather unusual surroundings. If 2020 has taught us anything, it's the vital role that public health plays in our society. Physicians and nurses are the heroes in the ICUs and the emergency rooms, but such a heroism was really only necessary because the politics that surround public health have failed us. Public health has been sidelined for too long with too few resources. Politicians have complained about the nanny state when they should have been equally worried about what James Wilson calls the neglectful state. They have worried that public health will lead to a loss of freedom, like the freedom to ride motorcycles without helmets, to drive without a seatbelt, to smoke, and to eat trans fats. But we've now seen too clearly what real loss of freedom looks like when we have to confine ourselves to our homes just to provide a modicum of safety for ourselves, for our families, and for the healthcare workers that are trying to stem this pandemic. Public health is all about creating real freedom, the freedom that comes when everyone has meaningful choices to fashion meaningful lives, unconstrained as much as possible by the oppression of poor health and poverty. More than ever, we need public health, and we need the kind of public health that our graduates can provide. We need people like them with interdisciplinary training and with a global perspective to help us pick up the pieces after the coronavirus has ended, so that we can create a better world. Public health is charged with creating systems to protect our health, and we must, as a society, figure out how to develop robust public institutions that can survive the current onslaught and withstand the future ones. A set of institutions that will promote the well-being of everyone in our society, from the richest New York real estate developer to the poorest undocumented immigrant. As a global society, we need to develop programs that do more than protect the fortunate. If the coronavirus can devastate wealthy countries, just think what it, or something like it, can do to the less fortunate corners of the world. We must build institutions that acknowledge the value of every person, wherever they live, whoever they are. Creating a better world is a deeply moral enterprise. That's why I'm in this program, why someone who's an ethicist works with public health. We always do better when we put the values of social justice at the forefront of our work. These students have the knowledge and the skills and the passion to fight the good fight here. For that reason, even in the midst of our current travails, we have good reason to look to the future with hope. Good luck to you all.